Did you know that autism affects 1 in 36 children in the United States? That's one child in nearly every classroom. But here's something even more shocking. Studies show that parents often notice signs of autism before their child turns 2, yet many don't act on it right away. Early detection is crucial because the sooner you spot the signs, the sooner you can help your child get the support they need. In this video, we'll explore the 6 early signs of autism that every parent should be aware of. From the way your baby looks at you to how they play with toys, there are early clues that can make a huge difference in your child's development. We'll give you actionable tips on how to spot these signs and what you can do next. If you think your child might be showing some of these signs, don't worry, you're not alone. Let's dive into the world of autism and uncover the important steps you can take right now. Keep watching to learn how small changes in behavior could reveal so much more than you realize. Chapter 1. The silent signals. When your baby's eyes speak, as parents, we know the importance of eye contact, but did you know that a lack of it can be one of the first signs of autism? Studies have shown that infants with autism may have difficulty making eye contact or maintaining it with caregivers. The eyes may dart away quickly, or they might not focus on faces as consistently as other children. This behavior is often subtle and can be mistaken for typical infant shyness, but it can be a key indicator that warrants attention. Interestingly, research suggests that by the age of 6 months, babies typically start focusing more on the eyes of people around them. For children with autism, this natural development might be delayed. In fact, a 2017 study published in Nature found that babies at risk for autism spent less time looking at faces compared to typical infants. But don't panic. It's crucial to remember that no 2 children develop in the same way, and a lack of eye contact alone is not a guarantee of autism. One strategy is to gently encourage eye contact by making it a fun game. For example, try playing peek-a-boo, or using toys with large eyes that capture your baby's attention. This can help increase the amount of time they focus on faces. However, don't force it. Just like with any skill, a patient, nurturing approach works best. Another tip is to observe your baby's interest in social interactions. Do they respond to your expressions or the emotions of others? Babies with autism may not respond as expected to emotional cues, like smiling back or showing concern when a parent looks sad. Pay attention to how your baby reacts during shared moments with you. If you notice a consistent difficulty with eye contact, consider discussing it with your pediatrician. Early detection and intervention are critical, and even if it's just one of many signs, you can gain valuable insight into your child's development. Remember, being proactive early on can make all the difference in your child's growth. Chapter 2. Language lag. When first words don't arrive on time, speech development is a major milestone in any child's life. However, when your baby starts missing milestones like babbling or saying their first words, it might raise some concerns. Language delays are a hallmark sign of autism. Around 25–30% of children with autism show signs of delayed speech, and for some, they may not speak at all until much later. In fact, a 2011 study from the Journal of Autism and Developmental Disorders discovered that children with autism often show a significant delay in speaking their first words compared to typically developing children. By age 2, many children have already started using basic words like mama or dada, but a child with autism might still be silent or only use simple sounds. One way to encourage speech is by talking to your baby constantly, even when they're too young to respond. Research suggests that children who are spoken to more frequently develop language skills more quickly. Repeating words during everyday activities, like saying bye-bye when leaving the room or drink when offering a cup, can help. It's also important to model simple phrases and make eye contact as you talk. If your child isn't saying words by age 1, it's a good idea to start early intervention therapies. These might include speech therapy or play-based interventions to stimulate language development. The earlier you seek help, the more effective these therapies can be. Another thing to consider is the quality of the sounds your child makes. Instead of pointing out what they aren't saying, focus on the small communication attempts they do make. A child who points to things, gestures, or uses nonverbal communication is still trying to communicate and can be encouraged in this way. Language development is a complex process, and while speech delays are common in children with autism, they don't always define the future. Many children catch up with the right support. But if your child isn't saying words by age 2 or has trouble understanding simple directions, consulting a professional is a crucial step. Chapter 3. The World of Wonder. How sensory sensitivities show up. Children with autism often experience the world in a way that's different from others, especially when it comes to their senses. Sensory processing difficulties are very common in children with autism, and they may become overwhelmed by sounds, textures, or bright lights. A baby who is sensitive to certain fabrics or avoids certain noises may be trying to communicate a sensory sensitivity. Did you know that studies show about 90% of children with autism have sensory sensitivities? This could mean your child becomes agitated by the sound of a vacuum, or they may have trouble with certain textures, like the feel of certain foods or clothing. This is one area where parents may first notice something that doesn't seem quite right but may not know how to interpret it. Understanding this behavior is important because it allows parents to help their child feel more comfortable in their surroundings. If your child seems overly sensitive to sensory stimuli, try creating a calm, quiet environment. Dim the lights, reduce loud noises, and observe if your child becomes more relaxed in a peaceful setting. Another approach is to engage in sensory activities that are gentle and structured. Things like water play, soft touch toys, or even yoga exercises can help children with autism regulate sensory input in a way that feels safe and predictable. It's important to experiment with different types of sensory experiences to see what works best for your child. Interestingly, while sensory sensitivities may cause distress, they can also be a strength. Many children with autism have heightened senses, and they may notice details that others miss. This can give them a unique way of interacting with the world. For example, some children with autism have an extraordinary memory for details, like remembering the smell of a specific flower or the pattern on a toy. However, if sensory sensitivities seem to be affecting your child's ability to participate in daily activities, it may be time to seek help. Occupational therapy can provide valuable tools to help your child process sensory input in a way that makes them feel more at ease. It's important to note that not all children with autism have sensory sensitivities, and those who do may not have the same reactions to every stimulus. The key is to observe your child's reactions and create strategies that help them navigate their sensory world in a way that feels manageable and safe. Subscribe now. If you found these tips helpful, make sure to subscribe for more insights on autism and parenting. In our next chapters, we'll dive deeper into social and emotional development, and how to support your child in these areas. Don't miss out. Chapter 4. The Social Puzzle. Clues in Playtime and Interaction. One of the most telling signs of autism in young children is how they interact with others, especially during play. Social development typically follows a predictable pattern. Babies begin by observing others, then progress to mimicking actions, and eventually engage in shared activities. However, for children with autism, this developmental trajectory can look a little different. A study published in Autism Research found that by the age of 2, children with autism often struggle with pretend play. For example, while a typically developing child might use a doll to mimic feeding or playing house, a child with autism may not engage in such imaginative play. This can sometimes be seen as a lack of interest, but it's often due to a difficulty in understanding social roles or the concept of make-believe. One strategy to encourage social interaction is through structured play. Setting up simple, guided play sessions can help your child feel more comfortable with social cues. Try activities like building blocks together or reading interactive books that involve pointing to characters and asking questions. This approach can promote shared attention and help foster early social connections. Another important observation is how children with autism engage with others during play. Do they avoid joining group activities or seem to prefer playing alone? These tendencies may indicate challenges with social interaction. However, it's crucial to avoid labeling the behavior as just shyness. It might be a sign that your child finds social interaction overwhelming or confusing. To encourage social development, try to create opportunities for your child to interact with others in smaller, less overwhelming settings. Playdates or structured social activities with 1 or 2 children can help your child build confidence in social settings without feeling overstimulated. One unique fact is that social difficulties are not always related to a lack of empathy. Many children with autism do understand others' emotions but have trouble expressing empathy in a socially appropriate way. For instance, they may not know how to comfort a friend who's upset. Parents can help by modeling how to offer comfort and explaining emotions in simple, concrete terms. Remember that each child is unique. Some may take longer to warm up to social situations, but with patience and support, they can develop social skills at their own pace. Chapter 5. Meltdown Moments. Understanding emotional overload. Tantrums are common in toddlers, but when a child seems to have frequent, intense emotional outbursts, it may be more than just a typical meltdown. In children with autism, meltdowns often stem from being unable to express themselves, feel overwhelmed, or experience sensory overload. It's important to distinguish between a tantrum, which is usually a response to wanting something, and a meltdown, which occurs when a child feels they can't handle the situation anymore. According to a study published in the Journal of Autism and Developmental Disorders, nearly 50% of children with autism experience meltdowns as a result of sensory overload. For example, loud noises, bright lights, or crowded environments may trigger a meltdown. Understanding the cause of the meltdown is key to responding appropriately. The goal is not to punish the child but to help them feel safe and reduce the triggers that cause distress. One of the best strategies is to stay calm. It can be difficult to remain composed when your child is upset, but your calm presence can help them feel more secure. Try using a quiet, soothing voice and reassure your child that they are safe. Giving your child space and time to process their emotions is also crucial. Sometimes, simply removing them from the overwhelming situation can help them regain control. Another approach is to use sensory tools to help your child self-regulate. Sensory toys, such as a weighted blanket or fidget spinner, can help soothe your child during moments of emotional overload. These tools provide comforting input that helps children with autism calm their nervous system. Predictable routines are also incredibly helpful. Children with autism often thrive in structured environments. When they know what to expect, they are less likely to feel anxious and more likely to stay calm. Try to maintain a consistent daily routine that includes time for rest and sensory breaks. Remember, meltdowns are not a behavior to punish but a signal that your child is overwhelmed. Early intervention strategies, such as occupational therapy, can be incredibly effective in helping children learn coping mechanisms to manage their emotions in healthier ways. Subscribe now. If you're finding this information useful, make sure you subscribe for more expert advice on parenting and autism. We'll be diving even deeper into the topic in future videos. Chapter 6. Routines over spontaneity. The need for structure in their world. Children with autism often prefer routine and predictability. While many toddlers go with the flow, kids with autism may become distressed when their schedules are disrupted or when faced with unexpected changes. This need for routine is not a sign of rigidity but a way for children with autism to feel safe in an unpredictable world. Studies have shown that children with autism are more likely to engage in repetitive behaviors when their routines are altered. A 2018 study published in Autism found that disruptions to routine can increase anxiety and stress levels in children with autism. For example, something as simple as a change in the time of a meal or the order of daily activities can lead to frustration or meltdowns. One strategy is to create visual schedules. A visual timetable can help children with autism know what to expect throughout the day. Use pictures or icons to represent different activities, such as eating, playing, or napping. This helps your child understand the sequence of events and feel more in control. As they grow older, you can transition to using written schedules. Another useful tool is to offer transitions that are clear and gentle. Instead of abruptly shifting from one activity to another, give your child a warning. For example, in 5 minutes, we will finish playing and get ready for lunch. This gives them time to mentally prepare for the change. While routines are essential, it's also important to gently encourage flexibility. For example, during playtime, try introducing small changes to familiar games. You can suggest changing the order of the steps in a familiar activity or play with a new toy. This helps your child practice flexibility in a low-stress environment. However, don't force changes too quickly. Gradual adjustments are the best way to help your child adjust without overwhelming them. Small, consistent steps will gradually build tolerance to change without triggering anxiety. By understanding your child's need for routine, you can help them feel more secure and confident in their world. Structure and predictability are not only important for minimizing stress but also for supporting healthy development. Remember, the goal is to balance the need for routine with opportunities for growth and flexibility. Subscribe now. If you found these strategies helpful, don't forget to subscribe for more practical tips on autism and parenting. We'll continue to explore more ways to support your child in future videos.